Hello and welcome. This is Hands on Health, the podcast all about living your healthiest life on the coast. I'm Austin Miller.
And I'm Alyssa Evans. Today we're sitting down with Mindy and Katie from the CMH IT department. Thanks for joining us.
For having us.
Yeah, glad to be here.
Mindy and Katie are going to be here today to talk about the CMH portal and what it is, how you can use it, and ways you can use it to have a better experience at CMH. To start, Mindy and Katie, do you mind talking about what you both do in the IT department?
So my role here is as a clinical analyst, and what that includes is helping our caregivers use our EMR, so our electronic medical record, and that includes building new orders for clinics. It includes onboarding new caregivers as they join our team and helping make the system as efficient as possible.
So I also share the same title. I'm a clinical analyst here, and along with helping different caregivers with our EMR, we also in particularly help new doctors who come either locum or one of our own, and we help train them with using the EMR, as well as giving them elbow support for the first week or so that they're in clinic here, just if in case anything comes up and they might need something.
So what interested you two in getting into IT? Like, what led you to pursue a career in the IT field?
Honestly, for me, I feel that this wasn't really something that I ever thought I would be involved in. I started here as a CCR, which was great, just kind of getting to know how the hospital works, and because I had never worked in medical before. And then just along the way, the opportunity presented itself for me to kind of take a look at a position that was available in this department. And I was able to shadow in and see how they do things there. And it was really something that I thought I would like, and CMH gave me the opportunity to do that. So I'm very excited to be in this career path, and there's a lot of opportunity and definitely learning a lot and enjoying it. So that's kind of how I found myself in IT.
And what about you, Katie?
It's funny enough, I come from kind of an IT family. A lot of my family is engineering, and my dad did IT at our local community college growing up. So I would always kind of go to work with him and see what he did. Initially, I didn't think that was something I was going to do. I really liked more public health stuff, so I wanted to work with people more directly. So I spent a lot of time doing that. But I truly love data, and I really like making the data we have and we collect useful and meaningful. Similar to Mindy, I started here as a CCR because that was the first opportunity that presented itself. But like Mindy said, CMH really does give opportunity for people to grow here. So as soon as this opened up, I jumped on it, and I've been very happily in this analyst role for a while now.
I think that's great. And it's really neat to hear both of your backgrounds and how you got into it. And it's really cool to hear that you were a CCR before Mindy. I didn't realize that. So that's really neat to see that there's opportunity to grow and do different kinds of work in the hospital.
Yeah, I mean, starting here, I honestly, like I said before, I didn't really see maybe a career path in IT, but it's just been really amazing to be able to get those opportunities and kind of see how the hospital works as a whole, starting as front desk to where I am now, seeing what the providers are doing. It's just really cool to see that big picture.
Yeah, that sounds amazing. That's really neat. Do you two mind talking about what the CMH portal is and explaining to our listeners what it is and how it works?
Yeah, so our patient portal is a really good, useful tool for our patients to use for viewing their medical record. They can set their own login quite simply, and we're here to help them as well. And they will have access to see labs that may have been drawn, like results from that, different appointments they may have upcoming. It even gives them an opportunity to communicate with their care team, including their provider. So we know a lot of people really take advantage of that and really like using it.
Yeah, and I suppose what I would add on to that is we really want to stay current with the times. And I think with people having so much control or kind of autonomy with their healthcare, you want to have it at your fingertips. I mean, there's an app for everything, they say. So similar with our patient portal, there is an app on your phone that you can use to quickly, anywhere you're at, access your data. Like Mindy said, your labs, you can get your immunization record for yourself or your family. I've even used it for the COVID passport that it has because it has a nice little QR attached. So the ease of use and the portability of it is very helpful. And I think patients find that useful. And it's open to anybody. So, I mean, our patients use it, our caregivers use it who seek care here at CMH. It's open to anybody to use.
Excellent. Are there any groups of people who might especially benefit from using the portal?
Yeah, we've seen a lot of parents want to get portal and attach their children. If they have multiple children or just one, there's a function that makes it easy. We can use the same email to send that invite to add on the child or even a spouse as well, as long as there is a consent form we look for to be able to view each other's records. But as far as parents and children, it makes it really simple for the parent because they can kind of toggle between each child's account right on that same app, same login. So it's very useful for parents and wanting to see and have access to their children's records.
Yeah, I would agree. I would say families and people that are kind of in charge of other people's care, it's extremely convenient. Also, any patient seeking kind of chronic healthcare services here, such as like our cancer center patients or endocrinology, it's just nice to have that open line of communication, that real visibility of this is where I'm at in my care, and the connection with our team is really great through the portal.
Yeah, I think that's fantastic. And I think it's really neat that anyone can use the portal and it's really accessible to anyone. And that being said, what are the different ways that people can access it? I know, Katie, you mentioned that there's an app. So is there an app? And then is it also available on like desktop computers?
I would say the easiest way, so correct. So there's the app. And then also if you want to go, I think the fastest way for our community to access it is to go to our website, our CMH website. There's a really convenient button that's like right in the middle of that homepage that says patient portal, and it will link you to either to sign up to it, or if you want to just sign in, it's that same little button. So it's just very convenient, has all of other questions that you may have about the hospital are located on that page. But I would definitely recommend accessing on your desktop through our website.
Do you have any suggestions on how people can get the most out of using the portal? What can the average person do to get the most out of it?
First of all, just giving it a shot and trying and signing up for it, because I think maybe if you don't already, or if you're not familiar with something like this, because I know a lot of hospitals have their own portal, but if somebody has not signed up for one before or tried it out, I think they might be pleasantly surprised with how simple it is to navigate, and also how much it comes in handy too, whether it's sending a communication directly to their provider, or if they're just wanting to easily make a request, a certain appointment day and time, they can do that all right on their portal there. I know for me, it's come in handy, especially if I'm at an appointment that is outside of the CMH realm. I have my medical record access just in case the provider I'm seeing doesn't have my recent labs or something. So I have it right all there in my palm. So it's just been helpful to have that access right there. So I think you can get a lot out of it in different ways, however you're wanting to use that.
Yeah, similarly, I always think of my own personal examples of why I enjoy using the portal so much. I do have my children proxied onto my account, so I can easily message the care team. And also, let's say like the kiddo has a rash or something, you can take a picture, upload it, and send it and say like, is this something I need to come in for an appointment for, or should I worry? And then they'll help direct like, yeah, you can see right away, or no, maybe we'll wait and see. So that's been really helpful as a parent to have that kind of direct access. And also for the provider to be able to see like my description might be a lot different than like what it actually is looking like to them. So I think having that ability to show and upload things to the portal is pretty handy. I know other examples that people use it for is if they're taking like a log of their blood pressure and they can upload that personal log that they have. And then that integrates it right into the medical record here. So any provider anywhere in our system can see that record. So it's just a nice way to be a partner truly in your care.
Yeah, that's really neat. I didn't realize that you can upload photos. I think that's a really cool feature. Something that was mentioned earlier is the COVID passport. Would you mind just explaining that to people who maybe don't know what that is?
Once we started going live with a little bit more capabilities and kind of COVID passports became more widely required, I think for travel and other reasons, Cerner came up. Cerner is our electronic medical record and the host of the patient portal, but they came up with a solution to have a COVID center, and it's just a little kind of tab inside of portal. And what it does is it shows how many vaccinations you've had, the date they were given, what type that you had received. And it also gives you a QR code for an outside organization to scan and then take that information into their own system. So if that's needed, if you're traveling or if you're going to something that requires those vaccinations to be readily available, then that's been a pretty acceptable feature to use the vaccine.
Yeah, that's awesome. Are there any other functionalities you guys are anticipating being added to the portal?
There are some links inside of Portal. I know we've looked at trying to make bill pay a little easier. There are some links in there to kind of go to our outside system, but I think integrations like bill pay, like scheduling are all things that we would like to see down the line, but they're all still in the works, not quite the reality yet.
How would you say the portal has influenced the patient caregiver experience?
I think it's improved it. It seems it's a reality these days that, we're short-staffed in many different departments throughout the hospital, throughout our county. Sometimes it is hard to get through and maybe just make something as simple as an appointment. So I feel like this has improved a lot of the ease of communication from patient to provider, patient to front staff to make that appointment. I mean, everybody's so busy these days too. So it's just really nice to have it right there on your phone or even your home computer to be able to do things like that. So I think it's improved it quite a bit.
Yeah, and I'd give a shout out to our caregiver team. It's just another thing that they have to monitor and look at and make sure that they're not leaving communications unaddressed. And I feel like they've really stepped up to the bar. So from our MA staff, our front office staff, and our providers directly, they're all getting these messages, taking the time to respond to them outside of like a normal scheduled appointment or outside of normal workflow. And I think they really take pride in caring for our community. So I would like to give them some kudos for that.
Well, that's great. Is there anything else that either of you would like to add?
I think like Mindy said, just taking the chance on Portal and actually signing in if you haven't used it, just signing into your account and seeing if it's useful and just having it in the background for the time that it is, it's worth it.
Yeah, I have to agree with that. I was probably one at first that didn't really think I might use it or need it. And once I did, it's come in handy for me so many times. So I feel like just giving it a try, people will see a lot of benefit from it.
Well, Mindy, Katie, we really appreciate you coming on the show today and talking about the portal. I'll encourage everyone out listening as well to sign up for the patient portal. Sounds like it's worth it. Anyways, thank you guys so much for coming on the show today.
Thanks for having us.
Thanks so much.
This has been an episode of Hands on Health brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us next time for another episode of Hands on Health.